Good afternoon, everyone. A warm welcome to Dare to Care. For those who joined us yesterday, welcome back. This is the second day of our virtual experience. Throughout the 2 weeks, you will get the opportunity to participate and interact with scholar ambassadors, scholarship officers, university partners, and professional reps from the various public healthcare institutions. Do note that we have an ongoing leaderboard and contest section for participants to win attractive prizes. In fact, I think we have a contest that was launched at 12 p.m. You can go and check it out at the contest section. Live chat with our healthcare cluster booths and reps are also available today from 1 p.m. to 5 p.m. Do feel free to check them out. For today's session, there are 3 segments. First, we have a short sharing by our very own healthcare scholars, followed by a healthcare scholarships talk by MOH Holdings Scholarship Officer Serene Tan. We'll then have a sharing by NHG, UHS, SingHealth, and AIC. There will be a Q&A session for each segment, so do ask your questions in the Q&A panel. Unfortunately, we will not be able to answer all questions, so do upvote the questions that you want answers for. A note to all, we'll be online for 4 hours today. If you need to step out for a bio break, please feel free to do so at any time. The recordings will be played. Now, without further delay, I will be inviting our healthcare scholars for their sharing. They will be doing a short introduction of themselves, and we will be opening the floor for the Q&A session. The scholars are Li Su-Hui, an occupational therapy student from SIT, Celine Lee, a physiotherapy student from SIT, Hu Su-Yuan, a nursing student from NUS, and Liang Kuang, who is our Bachelor of Accountancy student at NTU. Su-Hui, please.
Hi everyone, my name is Shu Hui and I'm a Year 2 Occupational Therapy Scholar at the Singapore Institute of Technology. So I'll be giving a short introduction about why you can consider choosing occupational therapy as your future healthcare profession. I think it's very nicely summed up in this quote by Virginia Stoffel, who is the ex-president of the American Occupational Therapy Association. So the quote says, occupational therapy practitioners ask, what matters to you and not what is the matter with you. So the meaning of this quote is that OTs help people to return to their occupations, which are things that a person finds to be meaningful and important to them. OTs can work with people with mental and or physical disabilities, but no matter what, we always emphasize on focusing on the person's ability and not just the disability to view the person as a whole. So now I'll be sharing about some of my fun moments that I've had in school. So the first picture that you can see on the left is a picture of a splint that we made in a practical class. As you notice in the pictures, our curriculum is very practical heavy. So the second picture features a picture that I took from our anatomy practical, where we had to learn the muscles of the forearm. I think something that's also really unique is that we have OT merchandise, as you can see in the picture on the far right, which is the occupational therapy lanyard as well as a windbreaker. So moving on to some more fun moments in school. These pictures were actually taken from a group assignment that we did recently for one of our modules. So in this assessment, we were required to teach each other member of our group a new skill. So for my group, 2 of the skills that we chose were dumpling making and sewing. So it was a really fun activity with my group where we got to put the theory that we learned about group facilitation skills and group dynamics in occupational therapy into practice by carrying out a session with each other. So this is my advice to all of you who are aspiring to apply for the scholarship. I think firstly, you should research more about the profession, and you can do so by attending university open houses and talks. The 3 usernames that I provided there are Instagram links. So the first one, Care to Go Beyond AHP, is for all healthcare professions in general if you want to find out more. And the 2 below are for occupational therapy in particular if you want to find out more about that particular healthcare profession. My second piece of advice is to experience for yourself what the profession is like, and you can do so through attachments, volunteering, and open houses held by hospitals. So that's the end of my presentation. Thank you very much, and I'll be handing my time over to Celine now.
Okay, so hi everyone, I'm Celine, and today I'll be sharing with you about physiotherapy. Okay, so I'm year 2 physiotherapy student studying at the Singapore Institute of Technology. Okay, so what is physiotherapy? So physiotherapy involves the assessment, treatment, rehabilitation, and prevention of pain and injury for many physical dysfunctions. And I got this definition of the Allied Health Professions Council. So yeah, you can go look it up online. Okay, so I'd like to share with you about the three main areas of physiotherapy. So physiotherapy has many scopes of practice. So one of the main areas is musculoskeletal, which most people are familiar with, which is where we help patients who have problems with their bones, muscles, or their joints. So for example, patients with osteoarthritis, as well as those who may need rehab, such as after their ACL rehab reconstruction. Okay, so the second area will be cardiopulmonary, which is a lesser known area of physiotherapy. So actually physiotherapists, we are involved with the rehabilitation of patients with heart and lung conditions as well. As you can see over here on the bottom right corner, there's a physiotherapist giving an instrument to the patient to help them with their breathing exercises. So this will help to train the lungs. As you imagine, physiotherapists are always involved when there is a muscle involved. So our diaphragm is also a muscle, so that's part of our domain as well. And as well as the heart is actually a muscle as well. Yeah. Okay. So lastly, we have a neurological physiotherapy where we treat patients who have conditions such as stroke, cerebral palsy, as well as and even as well as Parkinson's disease. So why choose physiotherapy? So these are my reasons why I chose physiotherapy. So first thing is that I actually like to exercise, and it's part of my passion as well. I think it's very important to keep fit. So knowing this, right, I wanted to use this passion to help others. So I think that if I myself like to exercise, I can inspire others to put in effort into taking care of their physical body as well. And I also wanted an upbeat and fast-paced job. I think no day is the same for a physiotherapist because every patient is different and you have to think on the spot and really make quick decisions as well as to put your clinical skills to work. And I feel that I want to have this kind of job where won't be sitting down in one place. Yeah, because yeah, after a while it gets very tiring. Yeah. Okay. So yeah, I wanted to do something that will keep me engaged, and as well as I think there are many learning opportunities in physiotherapy. As you can see over here, like previously I shared with you about three main domains. So actually we do learn a lot about the human body, and I think I wanted to have this kind of knowledge and to be able to have a bigger scope of things in which I will know about and I can learn about as well. And one of my interests is actually I wanted to pursue neurological physiotherapy and help stroke patients as well. Yeah. So let me share with you about student life. So firstly, this is actually one of the health sciences camp that we have. So in SIT we have many health science courses. So this will yeah. So we actually have a combined camp that we have every year for the freshmen, and then this what we do in practical lessons. We have to teach each other how to use walking aids. As well as you have to think about exercises, and this over here you can see the suction cups is actually to help with pain, so it sends a current through the body to help relieve pain. Yeah. Okay, so just want to share with you about my experience as a MOH scholar. So what I like is definitely the volunteering opportunities that we have. That's where I get to meet a lot of the other scholars as well, and we work together to make the event successful. So recently we had one online because of the COVID situation. We had to make do with what we had, and yeah, it was still quite engaging. We asked the elderly to do make some Christmas trees. I think it was very fun. Yeah, yeah. These are some other volunteering opportunities that I went for. Yeah. Yeah, so we also have like service learning month when you just join in as a scholar, and there'll be some induction courses and workshops for you to attend as well. So there's many ways for you to network and to get to know more people around you. Yeah. Okay. So just some advice, make sure you do your research about the discipline that you're interested in and know what is the scope of practice as well. And also encourage you to do more volunteering, because I think that's where I found my own passions for like helping others, and found that healthcare is something that I can do and want to do like as my future career. And also speak to professionals if you're able to, and yeah, consider which discipline and scholarship. And as well, I just want to encourage everyone to just do it. Like don't hold back yourself, and really venture out and think about and try new things and see what can interest you. Yeah. Okay, thank you.
Okay, so thank you, Celine. Hi, everyone. I'm Shu Yuan, or you can call me Janice. I'm a third year NUS nursing student. I'm bonded to NUH under the NUHS cluster. So 3 years ago, I was like all of you, attending the healthcare scholarship fair after receiving my A-levels result, deciding on what healthcare course I should do and whether to apply for a scholarship or a sponsorship. So a reason why I chose nursing and I'm still really enjoying nursing is actually because of the diversity. So the diversity of specializations I can explore, diversity of people I work with, and diversity of people I can interact with and care for. So what exactly is nursing? So some may say we clean patients' diapers, while some others may say we just follow doctor's orders. Nursing, actually, to put it simply, is actually to provide quality care to our patients. This includes caring for their basic needs, ensuring their safety in their treatment process, as well as bridging the multidisciplinary team together to provide holistic care for our patients. So during our course of study, we actually really study quite very broadly. So like got anatomy, we study about medications as well as skills to actually provide the care that to deliver the care for our patients. So we also have attachments and like lab practices to actually hone these skills. Yep. So being a healthcare scholar has given me also many opportunities to be more involved as a university student and future healthcare professional. So I'll just share with you some of my experiences. So I got to interact and work with other healthcare students as a facilitator for healthcare scholarship induction camp, and as well as orientation group leader for my school's nursing camp. So planning school activities such as inter-house games for my school and university healthcare games with my peers from nursing and other healthcare faculties across the university actually allow me to hone my leadership skills and make me a better team player. So I also have the opportunity to collaborate with my fellow MOHH scholars to organize activities and CIP events for our scholar family. So through this myriad of opportunities, I got to learn from those I work with and serve, as well as develop soft skills which cannot really be learned in school. I'm also very privileged to experience campus life, where I got to make friends from various other faculties, and as well as experience the kampong spirit. While it was definitely exciting to be independent, it also really tested my self-discipline to balance having fun and my studies. So one of the highlights in my journey as a nursing student and scholar is actually my overseas CIP trip to Iloilo, Philippines with my nursing seniors and friends. So aside from giving back to my local community through various CIP events, including that of SHS, I had the chance to contribute to the community in Bejangan, Iloilo, using what I've learned in school. So during the 10 days of service in Bejangan, we conducted mobile clinics, provide health education, and even held forums to raise awareness on common health problems, including malnutrition, teenage pregnancy, just to list a few. Furthermore, we also get to experience the cultural diversity by staying with the local families there and visiting their public and private schools and their nursing schools as well. So this really widened my horizon as to what really lies outside of this little bubble that I'm so used to living in. So the journey as a nursing scholar, though it can be really challenging and tough, it is also a real exciting one. Heart, head, hands is a quote which my senior has shared with me when I was in year 1 and still ingrained with me. So what your heart feels, your head plans, and your hands do. So if you have the heart to serve in healthcare, I really do hope you will consider and answer this calling. So with that, thank you for listening, and I hope to see you as a fellow healthcare scholar. So I'll now pass the time over to Liang Kwang.
So hi everyone, my name is Liang Guang. So a little bit more about myself. I'm a second year Bachelor in Accountancy student at NTU, and I was actually awarded the SGIS scholarship, which allocates me to MOH Holdings. So previously I actually studied diploma in accountancy, so I decided to carry on a degree in accountancy as well. But ironically, I'm actually not very good in math. So, the common stereotype of accounting student being very good in math is not true. All right, jokes aside, I really enjoy how businesses work. And to me, the accounting function is a crucial part in every establishment. And that's why I decided to study accountancy. And along the way, I actually grew to want to do something more than accountancy and to contribute to the general population if possible. And that's why when I was given an unusual opportunity to carve out a career in a sector that's pretty close to my heart, I decided to take a leap of faith, and hence I'm here today. Yeah. So a little bit more about the opportunities that I have as a scholar. Basically, there's a lot of networking opportunities with very different people. Because most of the scholars are actually healthcare discipline related scholars, and there are a few of us who are healthcare administrators. So you can imagine the diversity of people that I can get to interact with. And also there's good welfare, there's constant checking in from my scholarship officer to ensure that I'm doing okay, and also developmental opportunities. So I'm currently actually in a planning committee for the upcoming healthcare scholars induction camp, which actually there are many scholars, both local and overseas. So I get to work with very different people. And definitely there are workshops as well that are related to my the skill set that I'm required to have as a healthcare administrator in the future, in which in this case is programming workshops. And lastly, there's the usual financial support and all. So the reason why I put an asterisk behind the overseas exchange is because unfortunately during now COVID cannot go. But usually, yeah, definitely there'll be opportunity for you to go overseas exchange for these kind of opportunities. So at the end of the day, I'd like to encourage everyone who are passionate to be part of the key healthcare sector to apply for the scholarships, regardless of which kind of scholarship that you are applying for. Stay safe during this time, and happy Chinese New Year to all. Thank you.
Thank you, scholars, for the introduction. Now, before we go into the Q&A proper, right, I just wanted to ask our healthcare administration scholar, Liang Kwang, a question. Liang Kwang, you're the only non-clinical scholar here, but you mentioned networking opportunities with scholars from clinical and non-clinical roles. Can you elaborate on the benefits of these networking opportunities?
Okay. So I guess the most important part is there are different perspectives that I can get to learn from, because there are many different problem solving methods that are taken from both healthcare scholars and those that are in healthcare related discipline and business student like myself. So I guess in a sense, I really get to be exposed to a lot of different perspectives. And definitely in terms of the latest development, I guess I'm also constantly being able to be exposed to both the healthcare related industries happening and of course my own business slash accountancy happening. So I guess if I were to sum it up, I guess it's really more of a very broad perspectives, and it gives me a lot of it gives me a lot of opportunity to explore a lot of things that most business students won't actually want to, or rather won't actually emphasize on, because I think most business students, they would want to focus in like finance or banking. So a very broad perspective. Yes.
Thank you, Liang Kwang, for your reply. It's very heartening to see that you are able to bond with the rest of the scholars, even in the non-clinical role. I think it is the passion to serve that binds you folks together. Now let's go into the Q&A section. The first question that we can answer, let me direct that to Su Hui, is that a user asked, how do I prepare for my scholarship interview?
I think firstly, you need to know which disciplines you are applying for, and you need to know the priority of your ranking. So for example, do I want medical social work first, or do I want physiotherapy first? And you should have a reason for that. I think if you've done volunteering opportunities or if you've had attachments in the past, I think this is a really good time to bring up were your experience and what you learned from those experiences. I think it's also important to understand the job scope of whichever profession that you are applying for. And I think you can also highlight personal qualities about yourself that you think will be helpful in the profession. So for example, if you have good communication skills, raise an example of that in your interview to convince the interviewers as to why you should get the scholarship. I think my last point, similar to what the other healthcare scholars have shared, is to just not be afraid to go and give it a try. I think part of it is managing your anxiety so that you're able to perform well in the interview. Yeah, good luck.
Yep. Su Hui, another question, right, is linked to the question you answered. When applying for the scholarship, do you think the interviews are looking for academic results? They're looking for passion? You know, what is it exactly are they looking for?
I would say academic results are important, but I honestly think that they are looking more for passion because um, whatever you study in university determines your future career and it's most likely going to be a lifelong one. So I think the interviewers are looking more at um, your passion for whichever discipline you're applying for, as well as the qualities that make you suitable for that discipline.
Thank you, Su Hui, for answering the questions. We have another question, and I'll like to direct it to Su Yuan. It's not upvoted by much, but I think it's very important. The question is, what is the difference between nurses and doctors?
Okay, so I think it's a very common question, and even I did 3 years ago I did consider between medicine as well as nursing. So I think for me one of the biggest difference for me is especially after many attachments. I think as a nurse you're a patient advocate, so you actually really get to see the care of your patient from when they're admitted all the way to they discharge. Then you're with your patient practically almost like 24/7, so you really care for the patient. So whereas for the doctors, usually in the hospital kind of setting, the doctors usually only see the patient like during their rounds or like when the patient like something like their condition deteriorates. Yeah, so um I guess for the deterioration part, right, as a nurse, you also have to detect, like you are the one detecting that, oh, patient is actually deteriorating. So I think really like as a nurse, you really get to have a very, very close relationship and interaction with your patient, which is something which I feel that as a doctor, you don't really have that opportunity and chance to do so. Yeah, so I think for me, that's the biggest difference. And I think even until now, I did not regret like choosing nursing instead of medicine. Yeah.
Thank you, Janice, for sharing. We have another question, and I think since we have a PT and an OT student here, I'd like to ask that question. Maybe Celine, you can answer this. How does a physiotherapist and occupational therapist work together?
Oh, okay. So basically actually physiotherapists and occupational therapists we actually work very closely together. So I can give you like an example of, let's say a patient, like we work on different aspects of the patient because like how a physiotherapist may help the patient will be we'll work on the physical aspects of like let's say for example a stroke patient is just experienced a stroke. So when going through rehab, they may experience muscle weakness. So we're looking at more of like the technical aspects, like, oh, this muscle is weak, or the knee how to say, the elbow like cannot bend as much. Then we will look at all those things, and we're usually the first ones to see the patient, I guess. But the occupational therapists will work more on another aspect of the patient, which is like what is their occupation, what do they want to do every day. So for example, if a patient is who had a stroke, we'll try to rehab them such that they get able to move their hands well. So but the occupational therapist may be the one who may ask the patient, oh, so what do you do for a living? So if the patient says, oh, I like to play piano for like audiences, then the occupational therapist will be the one doing the therapy of being able to turn their hands to be very meticulous and to be able to do all those things that are important. Yeah, so I would say yeah, the occupational therapist will work on those aspects. Yeah.
Thank you, Celine.
Okay.
Another question. So I'll open this up to everyone here. The question is, what kind of volunteering opportunities you were part of before COVID-19?
Okay, maybe I'll share. So before COVID-19, I actually volunteer like with my school as well as outside of school. So outside of school, I actually volunteer with CDAC to actually kind of like teach primary school kids. Yeah. So more related to my the course of study nursing, I actually was part of a inter healthcare faculty kind of volunteering called Trigen. So basically, like there is a team of like nursing students, medicine student, or can be physiotherapy student. So then we will lead secondary school or JC kids to do a home visiting of our elderly. So in this process, we also kind of like we are teaching the secondary school kids and JC kids a bit more about like our own course of study and as well as healthcare and how like basically to show it kind of also show how we care for a patient like in a kind of community setting. Yeah.
Thank you, Janice. I'm Nigel from the Healthcare Scholarships team, and I must comment on this topic. I think because of COVID-19, there's a lot of uncertainty with volunteers, especially the overseas volunteering, the volunteering at the nursing homes, that sort of thing. So we are reviewing each volunteer activity very closely. I think the most important thing is we have to really review the guidelines and make sure we are doing things in a safe way. Okay, another question. So I'll ask this question to Liang Kwang. Can you elaborate on the opportunities that your scholarships afford that are not available to non-scholars?
Okay. So I guess I'll answer more from a perspective as a accountancy student as I am. I guess the main difference would really be in terms of the kind of dialogues or networking session that I go to in a sense, because it's very rare for a business student to be having opportunities to go for like dialogues that are related to healthcare or like current affairs dialogues. And of course, all these are pre-COVID. And even during COVID period, there are also such opportunities through Zoom and virtual platforms. So I guess the opportunities, if you ask me, the key difference would really be the fact that I get to interact with a lot of healthcare scholars and other healthcare administrative scholars, like people from econs, from psychology and what's not. So it's really more of the different kind of interactions that I get. And of course, not to mention there are also workshops and all, which are common in a sense, because I would say that non-scholars would also have, but definitely there will be more frequent kind of this kind of opportunities as compared to non-scholars. Yeah.
Thank you, Liang Kwang. Okay, we have some questions that are related to the scholarship itself. I think later during the 2 p.m. session, we'll be answering this, or my colleague Serene Tan will be covering this in her presentation. We want to answer questions that are more that pertain to the scholars since they are here. So I'll be taking some of the more discipline and student related questions. So one more question I open up to the floor is, what kind of candidates or scholars are you looking for in terms of personality traits and character, whether it's passion and that sort of thing?
Okay, I think I can share. I think in terms of personality traits, something that is more important than academics is being open to learn, because in your healthcare profession, you will definitely learn a lot of things every day, not just in school, but eventually when you go out to work as a healthcare professional, you also learn from your colleagues, from your own discipline and from other disciplines. So I think having a positive attitude and being ready to learn new things is definitely something that is very important. I think you also need to really have a strong sense of empathy, because as a healthcare professional, the people who are receiving your service are doing so because they are coming to you with problems. So when people have problems, naturally they also have a lot of emotions that come with it, and their family is also involved in that as well. So you definitely need to be able to communicate your care and concern to the person and their family. So I think to summarize, openness to learning and empathy are two key traits that I would say are important.
Thank you, Su Hui. So we see many scholarship applicants on a yearly basis. And I think I want to add on to Su Hui's point. I think one thing that we are looking for our scholars is, like Su Hui mentioned, the empathy, but really the spirit of giving back, the public spirit mindset, the fact that the scholarship is actually not a privilege, but it is actually an area that you are supposed to give back to society. You're supposed to do good with it. So I think it's a rather overused and cliche quote, but you should ask yourself, what you can do for the scholarship rather than what the scholarship can do for you. We have some candidates that come into the scholarship interview and they are so full of energy, so passionate, and you can see that they really want to make a difference in patients' lives. They do want to serve, and they do things like going back to their schools, going back to their JCs, polys to volunteer even after they graduate. For example, I think last year I had one scholar, so he applied and he got it. He applied for the nursing scholarship, the HME scholarship. And I think even at the point of his graduation, even after he went to poly, even after he started studying, he is currently still going back to his secondary school for volunteering. So his CCA, his St. John's CCA. So I think for these kind of scholars, you can really see that passion that they want to do more. And I think this is really a key difference when we are interviewing candidates and we are going through the scholarship interview. Now another question. It's not with many votes, but I still want to ask either Su Hui or Celine, because I think it's important. We have many diploma students who are joining us today, so from various polytechnics. The question is it weird if a person with marine science diploma joins occupational therapy or physiotherapy?
Okay, so I would say the good thing about SIT is that we have like aptitude-based admission. So we will see like what have you done like outside of school and outside your degree as well, or like your diploma. So actually I do have some classmates who came from very different diploma courses, such as like from business, and yeah, it's like kind of not related at all. But they like to see like, oh, what have you done outside? So let's say do you have any like work experience, like maybe during before you apply for the course, have you like worked at like as like a therapy assistant, or have you volunteered at any organizations? So they look at all those things and what you can offer and share to them about like why do you want to join the course. So I would say you definitely need some have some experience or something, or to find something that can they can show to your interviewers that and say that, oh, this is where I'm heading towards, and you're sure that this is what you want. Yeah, I think it would be good to find something, those kind of experiences as well. Yeah, I hope that helps. Yeah.
Thank you, Celine. I think the courses that you study, occupational therapy and physiotherapy at the universities, are also a degree level course. So you'll be well equipped to become a physiotherapist and occupational therapist. I would say don't worry too much about having a marine science diploma. Just go for it. If it's really your passion, it's not an issue. Another question, what are the challenges of the jobs? I think I'll pose these questions to everybody here. Maybe you can have a short summary of what are the challenges in your discipline. I know that you guys are not working officially yet, but if you have clinical attachments or you hear from seniors, you can share with the audience here as well.
Okay, perhaps I can start. For me, I think this is more contextualized to my setting because I'm bonded to Tan Tock Seng Hospital, which is an acute hospital. I think one of the challenges for occupational therapists is to balance between spending enough time with each person to be able to build rapport with them, and also being able to see a large number of your clients. So I think it's difficult to be able to spend enough time with each person to build rapport with them and also help them to meet their goals, while at the same time ensuring that you are able to see all the people who are under your care and fulfilling their responsibility to all of your clients.
Thank you, Su Hui. Can someone share next?
Okay, maybe I'll go next. So, as a nurse, I think it's very common. Like I hear from my seniors as well as like during attachment, some of the nurses also share. It's very easy to actually kind of burn out in this industry because like every day you are showing care for someone. Yeah, like there's a very high expectation of you. You have to do like documentation, you have to serve medication, you have to care for your patient needs. Then sometimes your patient family also demands something, your patient demands something. So I think it's quite easy. Sometimes you get very overwhelmed with work, very overloaded, like quite stressful. So I think one of the ways kind of to overcome this is actually to really remember why you kind of enter this line, and really to have to continue to keep your passion burning. So as much as you want to care for your patient, I think it's also very important for us to also kind of self-care, like during this, especially in this line of work. So because of like shift as well, so the different shifts sometimes really can take a toll on your body also lah. Like usually you work at night, then the next day you're working early in the morning. So I think it's really rest and really to take care of yourself, and to also like spend time with your loved ones and friends also, to kind of like, you know, reignite the passion you have. Yeah, so that's it for me.
Thank you, Janice. Yang Kwang, Celine, you all want to share?
Oh, okay. Yeah, actually I haven't been to clinicals yet, but I would say like I think this applies to all the healthcare disciplines. It's like having to be like have a standard of like profession all the time. So let's say you have like your own personal things affecting you, like you can't transfer that to your patient. You know, like let's say you're not feeling your best, you know, you're feeling a bit like cranky. You can't just say, oh, like can't get angry at your patient for something they didn't do. You know, it's about really a lot about self-discipline and control. And I feel that it's something that you have to like learn to do over time. Yeah, and also in terms of physiotherapy, I feel that one of the challenge is getting to people to adhere to our exercises and to carry on the exercise program, because many patients get referred to physiotherapy and sometimes it's not their choice. Like they ask them, oh, why are you here? Then they're like, oh, I don't know, I'm just the doctor referred me. So like it's sometimes they're not willing to come by themselves, you know. So like you have to really get them to convince them that this is important for them, and like and it is worth continuing a exercise program, even though it sounds very hard because everyone's very busy and it's very hard to find slots and times to go and exercise. So I think one of the challenges is actually convincing your patients to adhere to exercises, and sometimes some patients may not want to follow, and you may feel very like rejected or dejected, you know, that your patients aren't following. But I think you have to focus on who is actually willing to come and exercise with you, and to focus on those that who are very compliant with you lah. Yeah. Okay.
And I guess to sum it up, I mean, I'm in an accounting profession. So I guess the difference between that profession and healthcare is really more of the different kind of hours that we are working. Sometimes our hours can be longer and we do more of the back end work as compared to patient service, which is more front end. But I guess there are definitely similarities such that at the end of the day, we should always remember why in the first place we set up to do what we are doing. And at the end of the day, we should also try to not lose track of ourselves and have a good balance between what we are doing, our work and our life harmony in a sense. So even though the challenges may be very different across healthcare and non-healthcare profession, I guess there are similarities such that at the end of the day, every job has its own challenges and we just have to push through it. And at the end of the day, yeah, we'll come out better. Yeah.
Thank you, Liang Kwan. Thank you everyone for sharing the challenges. Okay, we have one question, and I think there are a couple related to this question. It's actually the question of how do you find attachment at hospitals and clinics? Maybe those healthcare scholars, the clinical ones, you want to share?
Okay, maybe I can share first. So for me, how I got my attachment was through my JC. So the school organized it. So I think if your school offers opportunities, definitely do actively sign up. Otherwise, you can privately email the hospital or clinic that you are interested in being attached to. And I think it will be good if you specify which particular discipline that you want. So for example, within occupational therapy, there are different departments like hand rehab, neurological rehab, and orthopedics. So it will be good that if you email them, tell them that you are interested in applying because you are looking to gain experience to potentially apply for this course in university, and specify which areas that you are more interested in.
Thank you, Janice. So one of the things that has been disrupted because of COVID, right, is actually the attachment opportunities, the internship opportunities at hospitals. I think that's because our hospitals, they are really focused on the pandemic, and it's really hard to get these slots. And of course, the social distancing rules also make it difficult. But I think one of the ways you can gain experience in the hospital would be to, if you are having holidays and you want to do a part-time job, a temp job, you can go and work in the hospitals. I think there are a lot of healthcare jobs out now, part-time jobs and so on. And I think even though you're, let's say, a part-time patient administrator, or you're doing part-time job there, you can see how the entire hospital setting is. You can see the doctors, nurses, allied healthcare professionals, how they work together. And I think that's quite a good setting to see, because I think, like many of the scholars here, they mentioned the hustle bustle of the job, the demands of the patient. These are things you can see at the hospital on a daily basis. And I'm sure those of us who visit hospitals would notice these things. So do go ahead. I think the issue is not with the challenges to finding an internship, but more like if you really want to experience that there are opportunities available. We also have a question asking about attachments for 16-year-olds. Not too sure if there are jobs available for 16-year-olds, but what you can do is look out for the healthcare bus. I think we have a healthcare bus that visits secondary schools. The bus is interactive. You get to do activities, find out more about the discipline from the booth or the bus itself. So I think these are some ways that you can get more information about the disciplines and the career in healthcare. So we'll take a break from the public questions. I want to ask the scholars, right? Maybe all of you here, you are currently studying, and we have this pandemic, we have this COVID-19 that we are currently faced with. How are you all feeling about the pandemic? And you're going to a workplace which has been through the pandemic. It's very different from the past. Is there fear? Is there anxiety? How do you go about all this? And are you looking forward to working?
Maybe I will share. So I got the chance to I had a internship attachment last year, June, July. So it's kind of in the midst of like the pandemic, when it's like still like quite kind of hot. Yeah. So initially I was actually really very worried. So like I kind of didn't really want to go back. Yeah. Cause it's like, the pandemic is still like so like it's like not really well controlled yet. And then I was very scared that I go there, it's like more of a burden to the nurses than actually like helping them. Yeah. So but I think the hospitals really take precautions to, especially for the students. So like we have to wear masks. Then there is a very whole long orientation briefing as to what are the changes during the COVID-19. Then also we have to declare our temperature twice daily. So any symptoms of COVID, we have to report, and then most likely the doctor will assess and whether you are suitable to go back for attachment or not. Then during my attachment period, we also cannot cross cubicle, cannot cross the wards also, because you don't know what the patients at the other ward and stuff like that lah. So then for students, they don't allow us to do like suctioning, those that come very close contact with patient body fluids, that kind of things. It's a precaution for the students lah. So I actually just finished a 4 weeks attachment. So I think after gone through that, now the 4 weeks, I think I look forward more, because actually during the COVID-19 period, we don't really go back to school, so we can't really practice our lab skills as well. So I think it's a very big privilege that we get to go back to clinical to actually like kind of practice and also interact with the patients. So I think it's normal to be scared, to be worried, but rest assured, the hospitals really like, they take very big precautions, especially for students. Yeah. So I think because of that, I also kind of have a peace of mind, and my clinical instructors and the school professors also constantly check up on us and to assure us that everything is like really how to say, like everything is like really covered, like protected, like it's a very protected kind of environment lah, to a certain extent. Yeah.
Thank you, Janice. I think we maybe have Celine or Su Hui, one of you can share.
Oh, okay. Actually, yeah, I haven't gone for clinicals during this time, but I would say like I think as for me, like when I came into like healthcare, like, I was like kind of mentally prepared for these kind of things, right? Because like I mean, healthcare is like you're definitely going to be exposed to like a lot of, let's say your patients that are sick, you're definitely exposed to them anyway. So like this is just another virus that we just have no knowledge about lah. So I think it's you really have to have that kind of mindset to when you come in healthcare, that you're definitely going to be exposed, if not COVID-19, but other diseases or other things. So like you just have to be prepared to uphold your standard of hygiene and stuff. So but for me, I think this is quite interesting because like about cardiopulmonary physiotherapy. So physiotherapists are now more involved in terms of like we actually do help our COVID-19 patients also. So I think that brought like that part of physiotherapy to like something that was like lesser known about physiotherapy, that we actually help our patients who have lung conditions. So I think it's interesting to see how the physiotherapists are more involved now in the ICU and stuff like that. Yeah.
Thank you, Celine. Quick question. We have a question that reads, I heard from seniors that practical sessions in physiotherapy may require students to expose bits of their body parts. How true is this?
Actually, yeah, we actually do this. We do practical sessions. So okay, so we will have to definitely have to, as a physiotherapist, you definitely have to know like where are the anatomical points, where are the muscles, how to palpate for the muscles, how to like check whether it's contracting. So you definitely have to have like physical contact. So actually at first it was like very foreign to me as well. I was quite uncomfortable for the first few sessions, but I think after a while you definitely have to get used to it, because you can't be like uncomfortable around your patients. So when you go to the clinics, right, then you have to assess your patients as well. So I think after you get over the initial like a bit of uncomfortable here and there, you actually get used to it, because in a way you can't be uncomfortable on your patients, like when you need to like palpate for their muscle or like so don't worry, we actually learn during practical sessions how to protect our patients' modesty. So we have a lot like towels, and like we only expose parts that are required. So we learn how to tell our patients, I need to check like this part here, so is it okay if like remove your shirt, that kind of thing. So it's all very professionally done, and we will still be like for the ladies we still wear shorts and like sports bra lah. And so I think it's okay. After a while everyone will be like comfortable with each other, and don't worry too much about it. It's all part of the job lah. So you can't really avoid that. Yeah.
Thank you, Celine. One question for Su Hui, right? Is for OTs. Do you really have to handle medical procedures like medicine, injections in occupational therapy?
As an occupational therapist, you will not be the one directly administering the medicine or injection. That's the job of the nurses. But sometimes you may need to check the client's medical notes to see have they received this medication that they are supposed to receive, and if not, you will check with the nurses. And you will not be directly involved in the medical procedures, but sometimes your client may have things like an IV drip or catheter that you will still have to take note of in your treatment to make sure that it doesn't become detached. Although you will not be the one directly giving it to the person, but it's definitely something that you need to consider in your treatment.
Thank you, Su Hui. Question for Liang Kuang. What course does it take to be a healthcare administrator? Maybe you can elaborate more about the courses that are available, and what do healthcare administrators typically do? Because I think we do accept some of them, their courses are computer engineering, computer science. Maybe broadly give us a few of what are the courses that you can take actually.
If I'm not wrong, actually they are looking for really any degree except those that are very specialized, such as medicine, dentistry, and other healthcare related disciplines. So actually, I know of friends whom are actually studying law, if I'm not wrong, and they are actually going to join the legal side of the healthcare administration team, and also computer science, like what Nigel mentioned earlier on. So in another words, I guess on certain years they might specify that they are only looking for certain disciplines in a sense, but for most of the time they really accept a very broad range of general degrees. So I guess it really depends year by year. For my year, they were looking more for accounting related graduate discipline related students. So I guess the best options would be to just check it out in a sense, because they would have clearly state that on the application portal, they will state that what discipline are they really looking for. In a sense, it's good also so that you know what you're getting yourself into. Yeah.
Thank you, Liang Kwang. Want to comment on that as well. We have scholars who are also taking economics, public policy in the healthcare administration scholarship. We have scholars taking biomedical science, that sort of thing. So it's like what he mentioned, right? It's all the related courses except for healthcare, medicine, and dentistry. Okay, let's go for one last question. And I think we'll need to wrap up for the 2 p.m. session. So the last question, right, I think it's linked to quite a few of the questions asked. I've rephrased it a bit. So directed to all the scholars here, maybe you can answer with shortly, how do scholars keep up with grades, and what are demands of a healthcare scholar?
I guess I can go first. I guess grades wise, it I am not too sure whether it's the same across all the scholarships, but from my understanding is second upper in a sense, which is actually which is actually the requirement for all the scholarships or most of the scholarships out there. So it's not unattainable. So you definitely will have to keep a good balance between your own social activities and your own academics in a sense. And for me, at least, I don't find it too hard to really try to keep up with these requirement in a sense. I guess as long as you're consistent and do continue doing what you have been doing that brought you so far, I think more or less maintaining a scholarship shouldn't be too much of the concern if you are really concerned about it. And I guess if you ask me for healthcare scholars specifically, I guess the gist of it is you really must have the heart to serve and volunteer while you can or as much as you can. Yeah.
Yeah. Do you all have any like stigma at school? Your classmates are like, oh yeah, he healthcare scholar, he must probably know everything. How do you deal with such stigmas?
I guess for me at least, fortunately, there's no such stigma because it's already very different from what I am originally studying. But I guess if you talk about a stigma for scholars, there tend to be stigmas, but at the end of the day, in this 21st century, it's actually no much of a big deal. And as long as you work well with your peers and everything, yeah, I'm sure you will just be able to make as much friends as enjoy uni to the fullest as compared to the other non-scholars. So.
Okay, maybe someone else can reply, then we will slowly wrap up. Anyone face stigmas at school, or how you deal with the demands?
I think in terms of demands, it's really important to have a balanced lifestyle. Definitely don't focus your entire life on academics. You need to have things that you enjoy doing and make sure you schedule time to actually do what you like. I think in terms of the demands of a scholar, it honestly extends beyond academics. It also means conducting yourself well, whether it's how you behave when you're in public or even what you post on social media. That's really important too, because you represent your profession, your school, and of course MOHH. So I think it's important to behave appropriately in addition to keeping up with your academics. And I think Liang Kwang also mentioned that volunteering is important to be able to maintain that spirit to serve.
Thank you, Su Hui. Okay, it's 1:58 p.m. I think those are the last of the questions. Thank you very much, scholars. And to the audience, if you want to interact with scholars, we have another session coming up on the 27th. So we will be having scholars from other disciplines as well, and it'll be the same session. You can ask them questions. So scholars, thank you for sharing with us today. You can take your leave. Next up, we are moving to our next segment. So Serene Tan, a scholarship officer, will be sharing with us on how you can make a difference with healthcare scholarships. A housekeeping reminder before we start, remember to ask your questions in the Q&A tab and also upvote them. We'll try our best to get them answered. Serene, I won't hold you back any longer. You may take over, please.
Thank you so much, Nigel. Hi, good afternoon, everyone. I am Serene from Healthcare Scholarships. So just give me a second while I share my screen. Okay, so welcome to the talk, Making a Difference with Healthcare Scholarship. As previously mentioned, I'm Serene, one of the healthcare scholarship officers in Healthcare Scholarships and Talent. So just a little bit of myself before I start with the presentation. I'm a scholarship officer specifically for NUS pharmacy scholars. So what I do is I take care of, I would say, if there's any issues that they have with their scholarships or they have any worries, kind of like a listening ear in some sense as well. So they are able to contact their scholarship officer, and a scholarship officer actually will be with them throughout the 4 years of their university course and through the years of their service, their bond period. So for our NUS pharmacy scholars, it will be 4 years at NUS and the other 4 years serving out their service commitment at their institution. Yes, so that's just a little bit of a brief about myself. So moving into the presentation slide. So this is a slide on the Singapore healthcare system. So just want to make known that Singapore's healthcare system is really robust. In terms of key health indicators, we are top. And in efficiency of healthcare system, we are second in the world. And lastly, for healthy life expectancy, we are first in the world. So Singapore healthcare system has been gradually getting better, but that being said, we actually do face some of these challenges. So challenges such as aging population, increased chronic disease burden, slower workforce growth, and lastly, the rising healthcare costs. So previously, yesterday in our session with National Healthcare Group, we talked about the aging population, the silver tsunami, and the things that the healthcare system is innovating and also creating to help keep up with the current population in Singapore. So if you have not checked out that video, do check it out. It's available on the website. So with these 4 challenges that are in place, and we do face them, Ministry of Health has actually put out these 3 strategies. So from year 2020 onwards, that's what we are looking at. So firstly, it will be healthcare to health. So I think everyone is pretty familiar that about the healthcare system in Singapore. But what Ministry of Health actually wants to do is to make the onus of health on ourselves, on yourself as a citizen. So as you know, that Ministry of Health is Ministry of Health and not Ministry of Healthcare. So that's a little bit of fun fact. So what it means is that we want you as a citizen of Singapore to actually take care of yourself. So that's why if you notice over the past few years, we do have things like the STEP Challenge introduced by HPB, Health Promotion Board, and a lot of advertisements on less sugar, fighting diabetes, making sure that Singaporeans actually live healthier lifestyles. So secondly, it will be the quality to value. So as previously mentioned in my first slide, that Singapore's healthcare system is really robust and the quality-wise is really very good. So what we are actually looking to do is to move towards with quality in mind to actually provide value to our citizens. So how can we further string our healthcare costs? And lastly, it's hospital to community. So we do note that everyone is quite familiar with the hospital setting. So your Singapore General Hospital, Tan Tock Seng Hospital, Ng Teng Fong Hospital. And with that in mind, hospitals wise, not for your old folks, sometimes they actually do find it a little bit daunting to go into the hospitals. That's why they actually put off their medical appointments. They don't want to go, or maybe for reasons such as it's just simply too inconvenient because they probably live alone. They have difficulty walking, they can't go to the hospitals for their regular checkup. So that's why we actually do have a mandate to actually bring healthcare to the community. So that's why currently there's a lot of emphasis on community care. So it's really bringing healthcare to the patient itself in the residents' homes. So this is the public healthcare scene in Singapore. Many people know about Ministry of Health. MOH, they are the policy maker. As for myself, I come from MOH Holdings. So at MOH Holdings, we are the strategic partner and the execution agent. So what it means basically is whatever MOH wants implemented, we at MOH Holdings, we are the execution arm. So at MOH Holdings, we take care of all the various healthcare scholarships. So for nursing and allied health professionals. And we also actually do look after the junior doctors. So your house officers, your medical officers, and also your dental officers. So that is the management of that is being centralized at MOH Holdings. Lastly, we partner very closely with our healthcare clusters and also agency. So as you have previously noted, our healthcare clusters actually have their booths open now, the exhibitor booths. So if you are interested, do feel free to check them out, and so you may chat with them today. This is the Singapore healthcare map. Singapore map, sorry. We have 3 different healthcare clusters which take care of different regions in Singapore. So National University Health System takes care of the western side of Singapore. National Healthcare Group will be central, and for SingHealth, it will be the eastern regions of Singapore. These are some photos of the hospitals that our clusters manage. So I think some of you are quite familiar with this scene. So like Tan Tock Seng Hospital, we have National University Hospital, we have Sengkang General Hospital. And as you can see, within the past few years, we have quite a few new hospitals that have been popping up in Singapore. Yeah. Moving on to community care in Singapore, we have Agency for Integrated Care that is a central partner. They work with the various community care organizations to provide center-based, residential-based, and home-based care to our residents in Singapore. So some of the examples could be Sengkang Community Hospital, Ren Tze Com Hos, and also St. Luke Elder Care. So an overview on our scholarships, we actually do have quite a number of scholarship schemes. So do look out and take note of the scholarship schemes that are applicable to you. So this is mainly focusing on allied health and administration scholarship. If you are if you have you're a recent graduate of your A-levels, diploma or equivalent, you'll be eligible for the Healthcare Merit Award, Healthcare Administration Scholarship, and lastly, the ComCare Scholarship. If you are a current degree holder, whether you are in a current diploma or degree, if you are a current degree holder in one of the recognized universities and courses, you will be eligible for the Healthcare Merit Award and Community Care Scholarship. Moving on, if you are a current non-healthcare related student, you can still apply for a Healthcare Administration Scholarship and a ComCare Scholarship. Lastly, if you are non-nursing or allied health final year student or recent graduate, you can look at Healthcare Graduate Studies Award and Community Care Scholarship. So this will be more for your postgraduate studies. Moving on to nursing, if you are a current recent O-level graduate, you are applicable for the Integrated Nursing Scholarship and Community Nursing Scholarship. If you are A-level diploma or equivalent or a current nursing diploma or degree student, you'll be eligible to pursue either the Healthcare Merit Award or the Community Nursing Scholarship. Last, if you're an existing nurse seeking degree conversion, that will fall under the Community Nursing Scholarship. And lastly, if you're a non-nursing or allied health final year student or recent graduate, you can apply for the Healthcare Graduate Studies Award in Nursing. So that's been a mouthful, and I do understand that it may be quite confusing to some of you who are just new to these scholarship schemes, and so that's why do feel free to post your questions in the Q&A and we'll get to them. So across all our scholarship schemes, we are looking at common eligibility criteria. So the first one would be outstanding academic results. Secondly, good CCA records and strong leadership qualities, because this is a scholarship and we are looking to groom the future leaders of healthcare. So we do want to see the current leadership qualities that you do possess and how we are looking at someone with good leadership skills. Thirdly, it will be a passion for serving in the public healthcare sector. So how we can actually look at this is really if you have gone for any internships or attachments at the hospitals or anything to further your knowledge about the discipline that you're applying for. That being said, we do note that in this current situation of COVID-19, where our hospitals and in clusters are kind of tightening their measures, so they may not be really opening up their slots for attachments and internships. But that being said, there are other opportunities that you can look into, whether is it attachments at GP clinics, so whether you are going to be the receptionist at a GP clinic, or just volunteering at a hospital to actually talk to the patient. So from this, there's actually opportunities for you to interact with the various healthcare professionals. And from there, you can actually talk to them and further your knowledge about the discipline. So it does not need to be necessarily in the box of you having an internship in the various discipline, but you can think of other ways on furthering your knowledge about the discipline. Yeah. The last one would be the good communication skills, social and emotional intelligence. I would like to stress that this is really very important because you as a healthcare professional, you are interacting with a lot of people. You're interacting with the patients' families, your doctors, nurses, other allied health professionals, just to take care of this one patient. So you need to have good communication skills to communicate your action plan, what the patient is currently facing, a lot of different things that you need to be very succinct and concise in your communication skills. And this is really very important. And you also do need to be there for the patient families during this period that may be a very dull period in their lives. So yes, moving on to our 13 different health science disciplines. So you are able to pursue one of these health science disciplines in the Healthcare Merit Award, which I'll touch on more later. So it ranges from diagnostic radiography all the way to speech therapy. So out of these 13 disciplines, some of them you are able to pursue them locally, whether is it going to be at Singapore Institute of Technology, National University of Singapore, or if you are current O-level and you're going to your diploma, it will be either in Ngee Ann Poly or Nanyang Poly for diploma in nursing. But we do know that there are some disciplines that are not available locally, such as optotics, podiatry, prosthetics and orthotics, and respiratory therapy. So for these 4 disciplines, specifically, you have to go overseas to pursue them. And we do actually have sessions with our university partners coming up. So if you'd like to learn more about their courses, do join us for those sessions. So Healthcare Merit Award. So this is the first scholarship that I'll be touching on. So it's awarded to promising students with strong academic track records and a passion to pursue careers in public health. Eligibility criteria-wise, we are looking at Singapore citizens or PR. And as previously mentioned, those 4 eligibility criteria that I previously mentioned. These are the terms and benefits. We are a full scholarship. So what it means is that we pay for your tuition fee. We provide you with monthly allowances so that you are able to upkeep your expenses. There are things such as travel, pre-study allowance, and also clinical placement expenses. And there are things like commencement and distinction awards and sponsorship for developmental programs, which I'll touch more on later. So for this, the service commitment will be 4 years if you study locally, and 6 years if you study overseas. So essentially, it means that you go for your 4 years of university. Once you graduate, you'll come back to serve either a 4 years bond or a 6 years bond. So your total lifespan or your total time that we are looking at is 8 to 10 years. So it's a very long time. So it's really you really do need to consider what you like, because it's actually going to be part of your life for a very long period of time. So you don't go into it just because of the glamour or because it's just a scholarship, but you do need to know and ascertain your passion for this discipline you're looking at. Moving on to the Healthcare Administration Scholarship. So this is what previously Liang Kuan has mentioned. He is a scholar under this scheme. So eligibility-wise, it will be you'll be a Singapore citizen, and we look at your grades too, grades and other CCA records. Terms and benefits-wise are slightly different. So we provide your tuition fee, monthly allowances, pre-study allowance, and overseas exchange allowances. The service commitment, it ranges if you study locally, it ranges with the universities. So it ranges from 3 to 4 years, depending on which local university you are pursuing your degree at. Moving on to the Community Care Scholarship. So eligibility-wise is the same. So Singapore citizen or PR, outstanding A-level results, and we look at your CCA records too. And we also need you to have a strong interest to serve in the community. So a lot of times, a lot of scholars get very confused. What's the difference between Healthcare Merit Award and Community Care Scholarship? Terms and benefits, they're exactly the same. Your service commitment, exactly the same. The only difference is where you're going to be serving out your bond at. So for Healthcare Merit Award, you'll be serving out your bond in one of the local one of the clusters in Singapore. So that means your hospitals and also your polyclinics. Whereas for Community Care Scholarship, you'll be serving out in one of the community care organizations. So there is like your St. Luke Hospital, you have various community care organizations. Yeah, so that is the main difference between a HMA and a CCS. And for the Community Care Scholarship, it's not all 13 health science disciplines are applicable, only for physiotherapy, occupational therapy, social work, and speech therapy. So as previously mentioned, it will be either a 4 or 6 years service commitment, depending on where you pursue your studies at. Lastly, we have the Community Nursing Scholarship. So this is only for you to pursue nursing, and you'll be posted to one of the community care organizations. Eligibility-wise, exactly the same. Terms and benefits-wise, the same too. So this is a range of your scholarship bond period, depending on where you're entering the scholarship in, whether you're O-level, A-level, or a current diploma in nursing student. So moving on, this is our scholar development framework. It's a pathway that actually we do. We look at this throughout the whole journey of your scholarship with MOH Holdings. So we at MOH Holdings, we are there to partner you throughout your journey. So during your university studies, all the way to you starting your career and at your allocated institution. So once you start and you are awarded the scholarship, you'll go through a series of programs to actually expose you to healthcare disciplines, the various healthcare disciplines, Singapore healthcare landscape too. So we actually do have things like the healthcare induction camp, healthcare induction course, service learning programs, an award ceremony, and also various attachment opportunities. After you have started school, there are things such as your overseas community involvement programs, vacation attachments, tea sessions, and fireside chats, and student exchange programs, seminars, conferences, and the ability to join in Singapore Health Society. So let me touch on the two last points. So student exchange programs, seminars, and conferences. Each scholar is actually given a scholar development fund that you can tap on to actually go for student exchange programs, seminars, or conferences. So anything that allows you to better yourself professionally. So you are able to tap on these funds. So for my pharmacy scholars, they actually pre-COVID time, for their student exchange programs, you'll go to places such as UK. Some of them went to South Africa, US, to actually go for exchange programs to actually learn more about the pharmacy setting overseas. So that is something really quite interesting. In the current COVID times, because they can't go overseas, they are still attending online lectures, online talks. Yeah. Next, we do have Singapore Health Society initiatives. So this is a group that is founded by our scholars. So they actually organize things like local community involvement projects. They have a lot of bonding sessions amongst the scholars so that you are able to broaden your network as a healthcare scholar too. Next, once you have started work, you actually go through a healthcare orientation program. There will be engagements with senior healthcare professionals, because we do note that once you have started work is quite different from studying life. So there's actually this healthcare orientation program to actually bring you, kind of help you through the way from studying life to working life, to give you the basics of working and help you be kind of like a support arm for you once you have started working. These such networking events and engagement with senior healthcare professionals, they help you it gives you a macro perspective on the healthcare landscape. So you as a healthcare worker, you know why you are doing this every day. Because sometimes you go to work every day and then you think that, oh, am I really making a difference? So this kind of networking events, this kind of talks actually gives you like, oh, okay, this is the macro perspective. I do know what is happening. What I'm trying to do actually counts to Singapore, actually makes a difference in a bigger picture. So these are some of your career pathways. So once you have entered either as an administrator or a healthcare professional, these are some areas that you can explore within your institution. So whether is it management, you have administration and operations, leadership, clinical education research, and also technology and analytics. So these are some of the career pathways that you can think about. Moving on to the timeline. So we do note that there are quite a number of students joining here that have just received your A-level results. So congratulations. It has been a very hard year studying during the COVID period must be very different because it's the pandemic and things are so different. But well done that you have completed your A-levels and you have just received your A-level results. So we'll start off with firstly the application. So right now you are able to apply via Bright Sparks. Our application window is open and you can apply. Once you have been shortlisted, you'll go through one round of interviews, followed by the successful award. And then you'll go through the various scholar development programs, which I previously mentioned, and then your school will start. So I'm almost done with my presentation. So do sign up for our mailing list. We actually will send you more information about the various disciplines. We have quite a number of scholar stories, videos on the disciplines, on our healthcare scholars. So if you like, just scan this QR code and you can join our mailing list. Okay, so we'll go on to the Q&A session.
Thank you, Serene, for sharing with us the overview. I'll take some questions first because I think we let Serene catch her breath. So some questions in the chat box we have already answered by commenting. You can go and have a look at the answer. But I just want to answer this question here. What kinds of specializations are available to nurses? And are there any postgraduate studies past the bachelor's? So this question is a question on the career track of nurses. So typically, right, when you go into nursing as a bachelor's, you will be in a general nursing role or rotated across for a few years at least. And I think after that, there are various tracks available, like being a nurse educator, being an advanced practice nurse, for example, being a nurse clinician. But these are roles which require a lot of experience. They also require postgraduate courses. So we do have a Healthcare Graduate Studies Award, although this master's is meant for nursing. If you are a current nurse and you have worked in the hospital, I think you can explore with your supervisors on the graduate courses to take. or postgraduate courses to take. I think yesterday or maybe in the next few days, we'll have quite a lot of senior nurses, so you'll be able to see them. And I think the very fact that they're here sharing with us, that's also a form of nurse educating. And I think later on at 3:30, or is it 3:30? Yeah, later on we'll have a nurse educator from NUHS sharing with us as well, so you can ask her some questions. So another question, will my chances of getting a MOHH scholarship decrease if I intend to pursue a PTOT overseas instead of locally? So the question is no, we do have quite a few scholars that study overseas. What will happen is that after your interview and you're awarded the scholarship, we will work with you to on the place that you're going to start, on the university that you're going to study in. So just mindful that now, because of COVID-19, right, we are working very closely with the authorities. We're working closely with our foreign ministry, and we are basing it on certain guidelines that they recommend. So do note that, you know, the place where you're studying at, the country where you're studying at, we do have to adhere to their COVID-19 guidelines and policies as well. Okay, let me see. So courses to be healthcare administrator, I think we answered it. It's in the comments box. Is it more difficult to obtain a full-term scholarship or mid-term scholarship? I would say it's not really gauged in that sense, because a full-term scholarship would be one that you apply for after you get your JC or A-level results, or after you get your polytechnic results. Whereas a mid-term one is when you actually are accepted into university already and you apply for it like after your year 1, after your year 2. So this is actually good for some of us. You know, some of us, we might not have done so well in our A-levels or poly, but then, you know, we go to university and we are doing quite well there. So why not apply for a midterm scholarship? So I hope that answers your question. We have one question. Any useful advice of how to show the interviewer of your passion towards the career you choose in during the interview? So this question is rather tricky because every interviewer will be different. Every panel will be different. Everyone will be different in the panel. So we have senior nurse managers, we have directors of nursing, and you know, we can't really pinpoint a criteria and a checklist that says this person is passionate towards a healthcare career. But I think based on the panel's experience and the way you present yourself, from your CCA, from your volunteer records, I think we are able to gauge. So do show this in the best way possible that you can. I'm not able to answer the question in a checklist sort of manner. Okay, so Serene, do you want to continue with the questions?
Yes, I will.
Thank you, Serene.
No worries. Thank you all for all your questions. They're really very nice to see so many questions. Do feel free to keep adding on to the current questions and I'll answer them. So I'm going down from the bottom all the way to the top. I hope that I'm able to answer as many questions as possible. But if I don't and you do see a question that you're interested in, please feel free to upvote that question. Okay, the first question will be, what is the difference between scholarship and sponsorship? So at MOH Holdings, we offer scholarships, and at our cluster level and AIC, they actually do offer sponsorships. So what the difference would be is really, firstly, it will be the monetary benefit. So at healthcare, if you do get a scholarship, it will be a full scholarship, which means that it covers your tuition fee, your monthly allowances, and other things that I've previously mentioned. As for a sponsorship, it will only be a monthly allowance. So if you're interested in sponsorship opportunities, you can always feel free to chat in with our clusters, and also stay tuned for the 3 to 5 p.m. slots while they talk more about their institution, their clusters, and the various type of sponsorship schemes that they have available. So in summary, monetary benefits will be different. And secondly, would be scholarship versus sponsorship. Scholarship would definitely be of a higher tier. So it's really for the cream of the crop lah. Yes, so we are looking at talents for scholarship as compared to sponsorships. Okay. The next question is it advisable to wait until year 3 of university to apply for midterm award or scholarship? So I would say you are able to apply. So first, the basics of it, you are able to apply for the scholarship when you are in year 3. Yes, that's being said. But the thing is, if you are currently on track to graduate with second upper honors and above, and you are very certain that you want to be in a healthcare industry and also doing the discipline that you're currently doing, so why not? Why would you want to wait to year 3 to apply? Because the thing is, once you apply, we actually do back pay your tuition fee, and for midterm scholars, we do back pay your tuition fee until year 1 or sem 1. But the thing is, for your monthly allowance, it will only be from the point of award itself. So let's say if you apply from year 2, you get your tuition fee back paid, and your monthly allowances will be from year 2 onwards. But if you apply from year 3 onwards, you only get your monthly allowances from year 3. And that being said, your bond period is still going to be the same. So why not apply earlier? Yeah, so I would definitely suggest for you to apply earlier if you are currently in your year 2. But if you're currently in your year 3, yes, still feel free to apply for it. Okay, next question is, does that mean that dentistry and medical students are not eligible for scholarship? No, that's not the case. We actually do have a medicine dentistry scholarship that's under the Public Service Commission. So for that would be a midterm scholarship. So what that means is that you need to be pursuing your studies in either NUS or NTU School of Medicine or Dentistry before you can apply for the scholarship under Public Service Commission. Next question is, sorry, just give me a second while I scroll through the many questions. Is work experience required for scholarships? No, I would say that is not a requirement, because we do note that a lot of you guys are coming in from JCs, from polys, and so as such, you may not have a lot of work experience. When I talk about passion in healthcare, it really means it's through your attachments, your volunteering opportunities, that you know more about the healthcare professionals, not really through work experience itself, because we do note that because of your age, there may not be much work experience. Next question, is it possible to switch disciplines, example from occupational therapy to physiotherapy for MOH holding scholars? No, that would not be possible. I think even if you are a non-scholar, it will be very hard for you to switch within disciplines once you have started studying in your course itself, because each of our disciplines, they are very tailored towards the discipline that you are going to graduate in. So it's going to be very different and quite hard for you to switch from one discipline to the other. Must we know our application outcome before we apply for scholarships? What is the timeline for applications like? So I think Jin Hao is asking more for application for university. So if you are looking at applying locally at either National University of Singapore or Singapore Institute of Technology, because our timelines are pretty similar, so you actually do need to apply for both apply at SIT or NUS, and also concurrently apply for our scholarships at the same time. But if you are looking at going overseas, so whether is it UK, Australia or Ireland, because the application process is slightly different because of the timelines, and also because you do need to know of the list of approved universities from MOH Holdings before applying for the university. That being said, it's a slightly later timeline, and once you are being awarded the scholarship, and then you can apply for the overseas universities. Yeah, but also just that being said, also I would like to correct myself. So for UK and Ireland universities, because they do start about the same time. So if you do have some of the UK or Ireland universities that you're looking at, so you can actually just check in with us to see whether are these courses approved or not. Next question. Are diploma in pharmaceutical science or bachelor's in pharmaceutical sciences in NUS applicable for this scholarship? No, it would not be. Okay, so I think there are two parts to this question. Whether diploma in pharmaceutical science, whether you can apply for this scholarship. Yes, you are able to apply, but when you're applying for this scholarship, you will be pursuing pharmacy and not pharmaceutical science. So on your second part of your question, whether bachelor's of pharmaceutical science is applicable, no, it's not applicable because you do have to pursue pharmacy. So a lot of times, a lot of people ask me what is the difference between pharmacy and pharmaceutical science is for pharmaceutical science, it's more catered towards the pharmaceutical industry, whereas for pharmacy, there's things within your course to actually prep you for you to become a pharmacist in the healthcare setting or in retail. Okay, when do we apply for scholarships for diploma students before NS? So if I'm not wrong, this should be an NS boy. So for NS boys, you are able to apply for the scholarship after you have graduated during your NS2. So I would say for NS boys, you actually do have 3 times that you are able to apply for this scholarship. So straight after you have graduated and during the 2 years of NS. So let's say if you have been awarded the scholarship during your year 1 of NS, we'll hold on to your scholarship until it's time for you to start university. So we'll hold on to your scholarship. No worries about that. Okay, next question is, must the scholarships be applied prior to your studies, or can we apply them halfway through our study period? So you are able to apply it halfway through your study period, so that will be under midterm scholarships. Okay, one of the quite highly voted questions will be, do I need to confirm a placement in university before applying for healthcare scholarships? I think I briefly mentioned this previously because we do have this similar timelines. So you do not need to secure a place in university before applying for the scholarship. So you can do it concurrently. But that being said, you do need a place in university to secure your scholarship. So let's say you have been awarded the scholarship, but you do not have a place in university, then your scholarship will then be rescinded. Yeah. Is there a list of overseas universities that you can apply to? So this list will only be shared with you after you have been awarded the scholarship. This is because we are not allowed to endorse the overseas universities. Yeah, so our scholarship officers will advise you on the approved universities. Okay, I think one of the questions that I'm not too sure whether I saw it, but I would like to address. So how is the scholarship interview going to be like? So I think this is quite a lot. This is a question on a lot of people's minds. So it's a panel interview. So when you come in, it will be at least 4 people within the panel. So firstly, you have a chairman of the panel, which is going to be either a CEO, COO, someone very high ranking in the hospital. Secondly, you will have a professional representative. So let's say you're coming in for a physiotherapy scholarship interview. So there will be a physiotherapist over there to actually assess your knowledge about physiotherapy. Thirdly, there will be a human resource representative. And fourth, there will be a scholarship officer. So one of ourselves within the MOH Holdings Healthcare Scholarships team. So during this interview, even though it may sound daunting that you have 4 people here to interview you, but just remember that we are here to just get to know you better, to know why you want to apply for this scholarship. What's your personality, your past leadership skills, so that we can better ascertain whether you are a good fit or a good candidate for this scholarship. Okay, next question I see, is there a quota for scholarships? We would not say that there's a quota for scholarships, but we offer the scholarships based on the demands that we have from hospitals. So let's say hospitals this year, they want, I'm quoting an example. So let's say if they have 10 demands for physiotherapists, then we will then look at awarding 10 scholarships for physiotherapy students if we deem suitable. So it's not really a quota, but it's based on the demands that we have from hospitals. What is the deadline for application of various scholarships? Because we do have quite a number of scholarship schemes, it will be best that you check out our scholarship website on the various deadlines for the applications. Okay, next question is, I will be a final year diploma student next year and may need to serve NS after that. When should I apply for your scholarship? So I think this is pretty similar to what I've mentioned previously. So if you are an NS boy, you are able to apply once you have graduated and during the 2 years of your national service. So you can apply anytime during that three scholarship application cycles. When will I know if I have been awarded the scholarship? So actually right now we have scholarship interviews ongoing. So if you are certain that you want to apply for this scholarship and the discipline that you're looking at, please, we'll like you to send in your applications early so that you can be slotted in for interviews once you have been shortlisted. So all scholarship interviews, all applicants will know of their outcome by end of June 2021. So if you have applied for this cycle, you know your outcome latest by June 2021. Okay, next question is the interview for panelists on one interviewee, or is there more than one interviewee in the session? So yes, there will be 4 interviewers to 1 interviewee. And the duration of each interview will probably take about 20 minutes. Are we able to choose the hospital we want to work with during our bond? So you are in your scholarship application, you'll be able to rank your cluster of choice. So whether is it National University Health Systems, National Healthcare Group, SingHealth, or even Agency for Integrated Care, you are able to rank your cluster of choice. After you have ranked your cluster of choice, we will post you to the cluster, and your cluster will then post you to the institution. So let's say you are really interested in going into Tan Tock Seng Hospital to serve out your bond. Although it's not guaranteed, you can actually rank National Healthcare Group as your first choice. And then from there, we will, based on our internal shortlisting criteria and our guidelines, we'll then see whether we are posting you to this certain cluster, and after which your cluster will post you to the institution. Next, for students who have enrolled into Australian university, is it possible to apply for full-term scholarship if you have not received your Year 1 Sem 1 results yet? Unfortunately, because once you have started school, you will not be able to apply for a full-term scholarship, so that will fall under the mid-term scholarship. Are applications only after A-level results release? No, it's not only after A-level results release. So just for your knowledge, that we have actually opened our cycle from September of last year onwards all the way to Feb or March. So if you for upcoming graduates, so let's say if you're currently in JC2 this year, you can actually start applying with your prelim results from September onwards. But for those who have graduated and have gotten your A-level results or diploma results, you are able to apply for the scholarship right now. Sorry, just let me scroll through the questions. We have quite a lot of questions coming in. Okay, could you reapply for scholarships if you failed to get it previously? will the chances of getting the scholarships be lower? You will be able to apply for the scholarships again if you were unable to get the scholarship in the previous years. So what we would do is we will not say that it's harder, but because you have actually gone through the process, you kind of know what's going to happen during the interview. And actually, we do have previous records also. So we actually want to see whether from your previous interview and your current interview, whether there's any changes um, in your in how, let's say, whether you view the discipline, you have a better in-depth of the discipline, or whether there are some things that we thought that was lacking in the previous year, whether this year is being addressed. So it's not the case of that it's going to be harder, but it's a case of, have you really grown from the previous year that we have seen you? Yes. So I would not say it's harder. Actually, from my perspective, I would say that if you have gone through the previous scholarship interview and you kind of know what's going to happen, it's slightly easier for you as an applicant because, you can foresee like, this is going to happen. And then you are able to better prepare yourself also. So that's why that is a slight advantage that you may have. Okay, next question is, are all applicants given an opportunity for an interview, or is there a shortlisting process? So that will be because not everyone is guaranteed an interview. So once we have received your application, we will then shortlist your scholarship application. So only shortlisted applicants will be called down for an interview, because we do. Yes, so we actually only call down shortlisted applicants for interviews. Does MOHH decide whether a student should pursue an overseas or local degree, or will this be up to a student's choice? So for some of the disciplines, I think if I'm not wrong, you are referring to those disciplines that can be pursued either locally or overseas. So for that, during the interview itself, we'll actually ask you is whether there's a preference for you to go overseas or locally. So let's say you have a preference for either one of them, you have to state why. So let's say if you want to go overseas, reasons could be because you want to be independent, you want to see the other healthcare system, how is it going to be like? So if you are able to address our questions, and if we are able to see that, you are more suited for local or you're more suited for overseas, then we will allocate you accordingly. So it's not the case that, MOHH makes the final decision. You as an applicant, you are able to tell us why you are interested in either of the options. Will the panel consider predicted grades according to all assessments in JC2 or only the prelim results? So if you are applying before your A-level results release, we are only looking at your prelim results. And that being said, if you weren't shortlisted with your prelim results, after your A-level results has been released, we'll actually send you an email to ask you to update us with your A-level results. And then we'll do a second round of shortlisting. So do not worry, because we know that sometimes students are very afraid that their prelim results are not too good, because we do know that Singapore actually sets a higher standard for their prelims, and sometimes because of that, your students actually do not really fare that well for your prelims. But not to worry, there will always be a second round of shortlisting once your A-level results have come out. Have come out. Is midterm scholarship harder to attain? We would not say it's harder to attain because you're already in the current discipline. You need to be performing at least second upper honors and above. And I would say when you come into the interview panels, when we ask you about your why you want to go into this profession, you actually do have a better understanding about the profession because you are already in the discipline. So I would say that gives you an added advantage because you know that you really want this discipline and you're currently already in the course. So it gives you have better knowledge about the discipline already. So it's just we look at that you need to have second upper honors and above, and we also do look at your CCA records. What happens if the PR status has not been approved, but the applicant has already applied for it? So if I'm not wrong, so I'm not too sure whether this applicant is asking before she applies for the Bright Sparks interviews, Bright Sparks scholarship application. So for this is, as long as we know that you are currently applying for citizenship, and because we do know to apply for citizenship, you need to be of certain age. So just let us know of your PR application, and then we will let your citizenship application, and then we will keep you updated on what is required. Okay, the next one is quite high voted. So how well do you need to do for A levels to get a scholarship? So as previously mentioned, we are looking at outstanding results. A lot of people ask, what is outstanding results? What does that mean? So we actually do look at A's and B's, but that is really dependent on which discipline you're looking at. So for example, for disciplines that are more in higher demands from students, such as your pharmacy, speech therapy, and dietetics, for those we actually do need to look at straight A's because of the sheer competition amongst your peers. But whereas for the rest of the other disciplines, we are looking at A's and B's. Do remember to put your questions in the Q&A. So if there's any questions that we weren't able to get through during the Q&A, we'll still continue to answer it throughout the session. Okay, next question is, do midterm scholarship holders get equal opportunities as full-term scholarship holders? No, that would it differs from midterm and full term. The benefits also would differ. So because the thing is midterm, you have already started your, so like what I previously mentioned, the terms and benefits will change slightly. And as for the scholars development framework that we previously mentioned, some of the activities which were applicable to year ones will probably not be too relevant for you guys, but you will still go through the induction course, your induction camp, and the various opportunities that were listed down previously. Okay, I'll be taking 3 last questions. And so after these 3 last questions, we can go for a short bio break before we start with the 3 o'clock session. So the next question that I would like to take is, if I scored a lower GPA compared to someone else who scored better, but with fewer leadership volunteering experience, will I be shortlisted for an interview? So that's a very good question. So this question, we would like to stress that we look at your application in a holistic manner. So once you have given us your application, we not only look at your grades, we look at your CCA, your volunteering, your experiences, why you even want to join healthcare. So we look at all these various parts, and from there we do the shortlisting. So do not be discouraged if you did not get all straight A's or A's and B's and only just B's. Just apply and we'll look at your scholarship application holistically. So we look at you as a full person, not just based on your grades itself. Okay, the next question is, what is the difference between this scholarship and the PCP, so professional conversion programs, for career switch paths, and is there an age limit? So the difference between this scholarship versus PCP is slightly different because for this scholarship, we are looking at really A-level and diploma graduates without a pre-existing degree. as for professional conversion program, they are looking at mid-career switches. So that will be the main difference. Yeah. Okay, the last question that I'm going to take for today's session would be, what is the possible pathway I can take if I want to go to optometrics but am not in poly? Do I have to go overseas? Okay, so we do not have optometry within our healthcare scholarships, but we do have optotics. So optotics, they are the eye physios. They are you can term them as the physios for the eyes. So for this, it's only an overseas course. So you actually do need to go overseas to study that. Whether or not you need to have a diploma in optometry, that is not a need. Yeah, so you do not need to have a pre-existing diploma in optometry before you actually go for your degree in optotics. Yes. So I've come to the end of my presentation and Q&A. So I'll pass the time back to you, Nigel.
Hi, yeah, thank you very much, Serene, for sharing. For our next segment, we'll be having Sing Health, NHG, NUHS, and AIC share with us. So just some housekeeping announcements. Address your questions to the speakers. If questions are not answered, you can go to our booths to ask. We noted that there's a huge amount of questions. And I think it's 2:55 p.m. What we will do is we'll have a short break, and we'll come back at 3 to 3:05 p.m. for the next speaker, who is going to be from Sing Health. Yep, see you back at 3:05 p.m.